Hi, I'm Dr. Michael Gartner. Have you ever felt lost or unsure when a loved one is nearing the end of their life? As a doctor, the comfort and peace from understanding what's happening have been witnessed. Today, the signs that someone is approaching death will be discussed, a crucial topic that is often underspoken. It's important to get professionals like hospice involved, but let's go through this video to get a better understanding.
We all come to death in different ways, but unless it's a case of sudden or traumatic death, there are some recognizable signs. I'm Pauline Moyart, a Belgian nuclear medicine resident and dementia researcher. I make videos about end-of-life care because I believe this can guide families and help them understand the signs of impending death. The first sign you may notice is a decreased appetite.
So you see, decreased appetite is one of the first signs, but also decline in physical activity and overall weakness, patients spending more time in bed and potentially losing consciousness and drifting in and out of bed, and decreased appetite goes along with that.
Research now indicates that forced nutrition in terminally ill patients may actually worsen the patient's condition.
This is true, so you never want to force feed someone in this state because you're actually doing them more harm or causing them pain and not helping them.
Digesting food requires a level of energy that the dying person just may not have.
So the dying person, all your systems kind of shut down, and the GI tract is the last because the body's always protective to save the energy for the heart, the brains, and kidneys, mostly the internal organs. And so that's why the GI system is one of the first to kind of shut down. And then with loss of energy, you're just not going to metabolize food very well.
Carbohydrates are our body's major source of energy. When our bodies no longer have enough carbohydrates to metabolize, such as when we stop eating, they start breaking down fat to create energy.
And this is how people lose weight also. When you don't have much coming in, you start breaking down your fat stores.
As fat is broken down in the body, ketones build up. Ketones play an interesting role at the end of someone's life. The resulting raised ketone levels suppress hunger, thirst, and pain.
And this is why that patient is actually comfortable towards the end. They're not in any pain or discomfort when they don't eat.
Forcing someone to eat or drink at the end of their life may prevent this buildup of ketones and reverse this metabolic process, causing increased hunger, thirst, and pain.
That's why you don't want to force feed anybody towards the end of life, because you might cause them more damage.
Remember that patients are not dying because they are not eating. They are not eating because they are dying.
Correct. That's very important.
Artificial hydration can also create more discomfort. As the body shuts down, the kidneys are no longer able to regulate fluid well. This can cause edema or swelling in the legs.
Many times when you give them fluids like this and they start becoming swollen all over, you're doing many times more harm than good.
But worse, it can also cause swelling in the lungs. This causes distressing symptoms, such as shortness of breath and coughing. The reallocation of energy supplies also involves shunting blood away from non-vital areas, such as the arms and legs, to preserve oxygen delivery to the brain and heart.
Right, so the extremities can get mottled or cold. Just keep them as warm as you can, do warm blankets, and this is not a painful thing.
This may lead to cold and mottled extremities, which it then travels up from. It is not painful, but giving the patient an extra blanket may help keep them warm. Research shows that this occurs late in the dying process and is a cardinal sign that death will occur within hours to days.
You may also feel clammy and sweaty during this process as well.
A third sign you may notice is breathing changes. As the body dies, respiration progressively becomes a solely involuntary act, controlled by the brainstem. The primal part of the brain handles life-saving functions, when the rest of the brain is unaware of what's happening.
So what sometimes happens, there's a name for this, it's called Cheyne-Stokes breathing, the end of life, where there's fast breathing, inhale and exhale, and then there's a long pause, which is called apneic. So this is a very common sign towards end of life. It can also be a common sign with some brain injury or being in a high altitude sickness situation.
Breathing often becomes irregular. There might be periods in which a person is unable to breathe at all for as long as 10 to 20 seconds at a time. Administering oxygen does not help. In fact, due to these breathing patterns, oxygen is not likely to be taken deep into the lungs, which often results in drying the person's nose and mouth.
Once again, here's another situation where you're trying to help the person and you're actually doing more harm than good.
On top of this irregular breathing pattern, you may also hear a gurgling sound each time the patient breathes. This is because swallowing becomes more difficult, and secretions may pool at the back of the throat, causing the noisy breathing known as the death rattle.
And this may quicken death because sometimes this goes into the lung, causes pneumonia-type issues, which kind of quicken the end.
It is important to know that this is not distressing for the patient because they are non-responsive and deeply asleep at this point.
This is usually very at the end stage when no pain is felt and, there's only a small amount of time, a day or so, before the patient expires.
The fourth sign is incontinence. When we're alive, our brain constantly sends signals to tell different parts of our body what to do. At the end of life, these signals stop and our muscles relax. The sphincter is in a constant state of contraction.
So you also have decreased urine output, the urine is darker, and you have potential loss of bladder and bowel function are very common with this.
Fifth and final sign is agitation. You may find your loved one, who is typically lethargic, trying to stand up, get out of bed, or change position.
They go through this period where they have mental status changes such as confusion, disorientation. All this is really normal. Many times they don't even know they're doing this.
Though many people show some combination of these signs at the very end, they're not universal. And just because someone shows one of these signs, it doesn't mean they're actively dying. These signs are guideposts, not rules, and every sign has to be contextualized.
Right, so it's important to remember that every person experiences a dying process differently, and not all signs will be present in every individual. And so I hope this helps, this important topic that's very rarely ever talked about, and look for more medical information on the next videos.